promoting healthy living. You can watch us every Friday from 3 p.m. to 4 p.m. on Sky 793 MATV channel or online at www.matvchannel.com. Thank you.
Pour la promotion d'une santé saine et équilibrée, nous vous proposons de suivre notre émission tous les vendredis de 15h à 16h sur la chaîne MATV Channel, chaîne 793 ou sur internet www.matv.com. À très bientôt.
Bolanda biso mikolo nyonso ya mitano na ngonga ya misato te na ngonga ya mine na chaîne MATV numéro 793 oyo ezali na Sky. Bye.
Love your hands talk show.
Well done.
Dr. John Osuku Opio, a doctor in pharmacy and integrative medicine, who considers a blend of medicine of the past and present as a new solution to current health problems. With more than 20 years' experience in health practice, a range of medical conditions can be managed perfectly in a holistic manner. Specializing in chronic fatigue, infertility, diabetes, heart conditions, blood pressure, migraine, cancer, autism, sleep disorders, sickle cell, erectile dysfunction, memory loss, eye disorders, fibromyalgia, hair loss and baldness, immune system modulation, enhancing energy, stress disorders, weight loss, arthritis, nutrient deficiencies, and many other health problems. According to Dr. John Osuku Opio, natural health practice is the way forward.
It's Whitney Cololo and I will be your host for today. This program is brought to you by Health, Nutrition and Fitness Community Interest and Company. We are a social enterprise based in East London, predominantly the London Borough of Newham, which has a large majority of Black Africans. Our aim is to provide information on health, nutrition and general well-being for Africans and the Congolese community. We will be airing once a week. We will be holding a quiz TV show once a month, which will also be airing to show what we have learned throughout the rest of the past shows. And we will also be having a famous Congolese celebrity who will be holding these shows. Auntie Annie will also be doing her extracts and she'll be showing you 15-minute recipes that everyone can enjoy cooking at home. If anyone has any other recipes that they feel would benefit, any healthy recipes that would benefit the Congolese community and Black Africans, please do come on and we'll also be showing you these recipes. Right, now today I have with me Dr. John Osuku Opio, who is a doctor in pharmacy and integrated medicine. Hello.
Yes, thank you.
I would just like to ask you a few questions. These may be questions that people have wanted to know, maybe some people don't know, and just illnesses that are generally in the Black society and Africans. Our topic for today is cardiovascular diseases. So I'm going to start with my first questions. So what are cardiovascular diseases?
Yes, as the name stands, cardiovascular disease are type of diseases which are linked to the heart. From the word cardio itself meaning the heart. So simply, there are so many diseases which are linked to the heart, but we can group them as heart disease and stroke. Going further, we could extend the understanding of cardiovascular disease by thinking what factors make them to strike, or what factors trigger the type of the diseases which is being grouped under cardiovascular disease. So the main factors that are well known for the time being are grouped into as major factors and minor factors. We all know when you speak about hypertension, which is high blood pressure, that is one of the factors which can lead to cardiovascular disease. We are all aware, or we do hear, things like cholesterol. When the level is high, depending on which type of cholesterol, it is another risk factor which could lead to cardiovascular disease. We all know about being overweight, which is being termed obesity in the technical term. That is one of the other factors which could as well lead to cardiovascular disease. Going further, we do hear about diabetes. Diabetes is one of a disease which can be a risk factor to a cardiovascular problem. So the list can be endless, but as time goes, in the promotion of the information to the community.
What are the main types of cardiovascular diseases, and when are they most likely to occur?
Okay, the main type that we all know currently could be like heart attack, which could be like arrhythmia, which could be like ischemia, which could be like quite a range of them. They do happen depending on what type of life one goes through, what type of other medical condition somebody is suffering from. And in most cases, when you look at it, it's more affecting the organ of the heart where the muscle is concerned, and that's where the disease develops. If the muscle is being denied, like say, a good supply of oxygen, the muscle is not getting the strength, the rhythm at which the body is working, or the subject of pressure to the body due to a number of reasons where stress could be a factor, it can all develop into a range of diseases.
Our next topic is coronary heart disease. So let me start with this question here. What is thrombosis?
Thrombosis is, I would simply put it in a simple term for everyone to understand, the clotting of the blood in the blood vessels. This can as well be due to a number of things coming into play and the state of the victim. There are cases where if your blood is very thick, the tendency of it clotting within the blood vessels is always very high. So this one can lead to clot to start and can lead to what is called thrombosis.
Now, we hear people talking about blood pressure all the time. What is high blood pressure? Can you explain that to everyone?
Okay, the simple way to explain is like saying, when the blood leaves the heart, it has got to be pumped to all parts of the body so that there's enough supply of nutrients and oxygen to the body function. But it goes through a blood vessel which links the heart to all parts of the body. It has got to leave due to the fact that the muscle of the heart contracts to push the blood out of the heart. Now it leaves with a certain type of pressure due to the resistance on the blood vessel walls. Now if the passage at which the blood is coming out to be pushed is narrowed, then the heart starts experiencing a pressure which is higher than normal. So once the pressure is higher than normal, that the blood can start suffering. That is where we start hearing of what is being called high blood pressure. So it is the pressure at which the blood leaves the heart to go to supply the body function, and then the pressure at which it comes back to the heart when the heart is relaxing. So there are two outlets of points to understand here. The blood leaving the heart to go to supply nutrients and oxygen to other parts of the body, and then coming back from the other side to fill the heart so that it be going. So it's a cycle. So leaving, the press is I, then coming, the press is SI. So that's what's being called high blood pressure. So there's a range of figures or points which is standardized that makes us to know that this is high, this is not high.
What is cholesterol and how does high blood cholesterol happen?
As I've mentioned before, cholesterol is not a disease. Cholesterol is a substance in the body that, first of all, the body needs for making a number of things like hormones, inflammation process, function of the immune system, and the like. But depending on the type of cholesterol we have in the body, we have bad cholesterol, which is the bad news we always hear, but we as well have good cholesterol. So once the fraction of bad cholesterol is beyond what the body needs, then it would mean that it puts us to be at risk, and that's one way of starting to develop a cardiovascular problem. But it has got to be recycled, because depending on what the body is subjected to, like the lifestyles we lead, the food we eat, the bad cholesterol can always be recycled to the good cholesterol by taking proper type of nutrients and conducting particular activities which can be of value and assistance to the body function.
What is diabetes and what are its causes?
Diabetes is a very interesting term. Actually, I think in the common hearing, we only know about sugar diabetes. But there's another type of diabetes which is concerned with the disorder of a gland in the brain called the pituitary gland. That one is not a disease. It's just that a person can be in that sort of state, manifesting the symptoms that a diabetic person with sugar issue feels. So it is like a disorder which tends to affect the body, but is not harmful in any way. Coming to the diabetes, which is sugar, called diabetes mellitus, meaning the sugar level is high. We have three types. One, there's type 1 diabetes, then there's type 2, and then there's a third unique type of diabetes which comes in especially on women when they're pregnant, so that is called gestational diabetes. Type 1 diabetes is inborn, meaning you get it when you are young or when from birth, called juvenile diabetes. And the reason why one suffers from that is not the same reason why one will suffer from type 2. So type 1 could sometimes be due to the fact that the immune function that defends our body tends to be aggressive. So we all know that the sugar level is controlled by the hormone called insulin, which is really produced from the gland called pancreatic glands. Now, due to a number of factors, reasons that the person is exposed to, the beta cells which is in the pancreatic glands can be affected due to like being attacked by microorganisms like the virus, bacteria, or all other type of things like toxicity, environmental exposure, stress. So the body will be mistaken. Then it strikes these beta cells and it silences the beta cells to make it not really produce insulin and then or produce a bit. So in this case, either this type of diabetes comes when you are just born or when you are young. That's type 1. So you can either be dominantly or predominantly dependent on insulin that has got to be given to you. Or there are even certain type of type 1 diabetes where you don't need to take insulin all the time depending on what fraction of the organ remaining which can produce insulin responding the level of sugar. So that is type 1. Now when it comes to type 2, it is more of like adolescent diabetes, meaning that your sugar levels are getting high when you're an adult. So this is always due to a number of reasons. One thing is can be due to lifestyle changes, meaning that you're not exposed to physical activities. The body is no longer responding to the insulin which is being secreted, so that the sugar goes to the muscles, which is one of the organs, very important to push sugar to the muscles so that it uses it for producing energy in the body function to make you carry a normal day-to-day function. Now in that particular case, you find that The sugar is no longer moving to the muscles, so the only other cells which are remaining to take the sugar is the fats. So the fats will take the sugar is converted, then it starts accumulating, and that's why you see that in most cases type 2 the patients are having overweight. But it doesn't mean that if you're not overweight, you cannot be diabetic type 2. No, there are thin people who are also diabetic due to other reasons. So actually in most cases it's a misconception of understanding what diabetes is. And currently worldwide it's one of the major cases, like in the United Kingdom, I would say we have about 3 million people diabetic diagnosed. 850,000 are walking on the street undiagnosed. About 380 people are dying every day due to its complication. The service of diabetics condition in the United Kingdom is supposed to be at its best, but the worst results are being obtained. So that is the complication we are in. So it is the scourge of the 21st century. We need to go back to the ground, to the community, to start explaining, bringing awareness, educating them to understand, because medicine is education. It's not taking tablets.
What is diabetes and what are the main known causes? So how does someone get to a stage of becoming obese?
Okay, the question is, as I said, obesity is a risk factor. Now, once you are overweight, it means that you develop the resistance to taking sugar in the body. The muscles does not respond. So when the sugar level in the blood goes high, the muscle is not in a position to respond by taking it in to make it produce energy. Now, in that particular case, you find that the level of insulin starts accumulating and the level of sugar is accumulating. So you have got a double problem. So in that particular case, you find that the risk that comes in can even lead to cardiovascular problems that we have said at the beginning. The other risk is that you find that other diseases can start developing. One of the worst scenarios is coming to be that it's leading up to even loss of memory. Doesn't mean that dementia or Alzheimer, which is considered a disease of old people, is due to the fact that you are overweight or you are old. It's due to the fact that the sugar is accumulating. So sugar is the worst culprit we have ever had in the history of mankind for medicine. So it is something that we need to start from the grassroots and make people understand that you need to help yourself. There's nobody who can help you. You can't just be guided.
We're about to go on a short break. Please use this chance to either make a tea or a coffee, and we'll be back with you shortly.
I'm Dr. John Osuku-Opio. In my journey into a vision of integrative medicine, I have, for the first of its kind, composed a book which summarizes one deficient nutrient that we all need to sustain optimum health. This nutrient is one of those nutrients that if you are deficient in it, there is always a possibility of developing a chronic disease. And it is talking about vitamin D. Vitamin D is central in all conditions which are chronic or autoimmune. The world is trying to give a question globally to understand why is there a rampant deficiency worldwide. So in simple terms, simple language, not scientific, but for a lay person, I've written in an handy text a simple book which just picks on one nutrient that we all need. And if by any chance you get this book and read, then understand, you'll never be an exception of it, in the sense that you are vitamin D deficient. For whoever is in the continent of Africa, we are not supposed to be deficient, but research outcome has widely expressed that even where we're not supposed to miss it, we don't have it. Due to the fact that we make this vitamin D from our body, so we all cut the raw materials. I've decided to name the book Walking Medicine. So you are a walking medicine yourself, so long as you expose yourself to the sunshine in a moderate fashion. But if you have no possibility of getting sunshine in a sufficient manner by exposure, you can always take supplements. Thank you.
Welcome back to our show. Now, going back to the issue of diabetes, is stress a contributing factor towards diabetes?
Stress, as we all know, is a common word. It's the word of the day. 90% of all diseases of mankind is attributed to stress. So I'm not surprised if one would try to see or imagine a case where stress is a trigger factor. I'll tell you an incident. One of the well-known practitioners in life that we all know is from Netherlands, one time related a situation where a lady who has been very clever has never even had to know she is diabetic. So after when she has finished her school, she qualified, she wanted to go out for an evening with her friends. The parents are very strict, so they realized that, oh, let her go. She has never been diabetic and there's no diabetes in the family. Now, something happened to her which was so terrible in her lifetime and she has never expected. Having the time in the evening with her friends, somebody volunteered to drop her back home. You know, when you're always isolated, you don't know what goes outside. Yeah. So in the process, the person was a male person, partner never took her home. She was assaulted. She never expected, and actually she started developing a lot of stress. She went back home, she could not talk. Emotionally she was disturbed, and she started seeing another world of life which she has never had and she has never witnessed. So the parents realized that she wasn't to herself, so they had to take her to a doctor to check on what is happening. She kept what happened to her to herself, but the parents knew that something was not correct. So she told the doctor, when they were sitting, two of them, that she had that incident. So the doctor had to talk to the parents to find out if there was history of diabetes in the family, but they have never had. And then in the long run, he decided to test for the sugar. So see, he found that the girl, just because of that incident, she became diabetic. So that's one of the simplest reasons to tell you that stress of life, unexpected situation can always trigger diabetes. You can trigger any disease.
Does age and gender have an impact on diabetes?
Yes, because as we have said earlier that there are 3 types of diabetes. Type 2 is a consequence of age. We get it when we are becoming an adult, or when we are already an adult. So in theory, it is being believed or considered that anybody who is up to the age of 40 years old, be a lady, be female or male, who is not yet diabetic, is always a subject to risk for becoming diabetic, depending on the lifestyle of the person. Be that is female or male, we are all at risk of being diabetic. So gender doesn't play a role of determining who has got to be diabetic.
You have touched upon the different types of diabetes. What are the signs and the symptoms of the different types?
Okay, the signs and symptoms are mainly universal, but be that is type 1 or type 2 or gestational diabetes, which is the diabetes that happens when a lady is pregnant, we always have common signs or symptoms like frequent urination, being thirsty. One common thing which is a very good indicator is like having itchy skin. Doesn't mean that all the time you need to have frequent urination. Sometimes you can start having itchy genital parts. That's a very good sign. There are cases where somebody starts developing thrush constantly. That's a very good sign that there's a possibility of that person being diabetic. So those are classical symptoms that are so far done. But of course, when we go now to considering some lab tests, there are very obvious things we can pick on, which can tell us that somebody is already diabetic but is developing diabetes.
You said when you take the test, you can tell when someone is developing diabetes. Can this be stopped?
Well, thinking of the past as well as said that a disease can never be reversed. But right now in the modern world of the 21st century, many disease conditions are reversible, but that all boils down to the lifestyle and dietary management. So we need to engage ourselves on something called lifestyle medicine, which is not swallowing tablets, but knowing what you eat, what you're doing, how you're resting, what you're avoiding. So that is the basics of health that we need all to engage ourselves on and understand. And it would always be very easy to pass this message to the community to practice.
How is an individual's lifestyle associated with cardiovascular disease? So how does it determine how the risks of you getting it?
Okay, if you like say what we term sedentary lifestyle, meaning that you don't become active in a number of things that you do around, like, physical activity, you don't engage yourself in physical activity, the possibility is that the body is going to develop resistance in taking sugar due to the fact that the insulin is not responding. So that is a situation where there's a high possibility that somebody is going to develop diabetes. But once you become yourself engaged physically, not saying you do 10 hours of physical exercise, which of course, to everything there's a bad end of it, you need to do something within a particular time, within a particular range, and within a limit. That's when we can always benefit from both sides of the story. The other thing is, of course, like considering what you eat. I mean, the time you eat what you eat, we need to go into what we understand as a balanced diet. Balanced diet is always a misconception. If you look into that, it is a situation where we are supposed right now to think of having someone who understands about diet and nutrition. This is not something new. If you go back to read about history, in the 18th century, some people like Thomas Edison has quickly said and earlier said that the doctors of the future will always prescribe dietary supplement rather than medicine. So this sort of thing we tend to forget about it. And if you go back to see at how our ancestors came up, they were on what is called paleo diet. It has never had anything which is saturated fats, but it was always balanced. Fruits, physical exercise, meat what you mentioned, but it has always been balanced. So it would mean that in whatever we eat every day, we must think, what portion of the proteins am I putting in? What portion of the carbohydrates am I putting in? And what portion of the fats? This has got to be in a certain ratio, which is normally determined by the culture, the heritage of a particular individual. It is very difficult to have a standardized nutrition program, but always background culture tells us what works well and what works best. We cannot rely on modern thinking, because modern thinking is becoming outdated in the sense that if it doesn't work for somebody, why is it going to work for yourself? So it is us going back, trying to look at the basics. That is where we have got the answers.
So family diseases, if it's part of a family history, is it more likely that you are able to catch it?
The fact is, a family disease is a warning. It doesn't necessarily mean that if a certain type of disease has been in the family line, you're going to catch it. But it is a precaution. A signal is more like a marker to you that, look, my mother, my father, my grandfather had this. But if I take certain type of steps, I can avoid that. So we should never be fooled by saying it's a family disease, you need to get that. No. Changing lifestyles will always modify the body to make you not be a victim.
Now we hear people talk about smoking and how it's bad for your breathing and your heart and your lungs. How is smoking directly linked to heart diseases?
It is one of the major risk factors which has caused a lot, in the sense that a smoker will always have the blood turning to be thick, will always have the thickening of the arteries, it will all promote the clotting of the cholesterol. So it is a major risk factor directly linked to the cardiovascular disease. And in most cases, cigarette contains about 4,000 chemicals. One of the chemicals which is so detrimental to the body function, especially the cardiovascular system, is the tar. It is a free radical. Free radical is being considered to be one of the major factors to convert the good cholesterol to the bad one. So it starts accumulating. So you can see that it's a major player in all aspects. It coordinates with other factors to increase the risk. But once somebody goes through the program of stopping smoking, you can find that even if you have smoked for 10 years, once you stop smoking, after about 3 years, you find that the risk of cardiovascular events due to smoking as a factor is minimized. Of course, you cannot take only one risk factor to get rid of. You have to look at the associated factors so that your state of health can improve and you can be safe from the unexpected cardiovascular events, which can be detrimental and destructive.
How do physical activities and lifestyle changes have an impact on treating or preventing coronary disease?
Definitely, it's one of the major factors to be looked at, one of the major activities to be engaged. It doesn't only help in trying to reduce the risk of cardiovascular events. If you hear what's going on in chronic health state, we have issues like cancer. So you find that physical activity is one of the cost-effective engagement have got to be in so that we could try to reduce risk for a number of these diseases trying to threaten mankind. So it's always encouraged, but then we need to look into which type of physical exercise we're going to do. Anybody can do any physical exercise, from baby to an old person. So we have to see which one to make sure that it's appropriate to the person in question. And then, of course, we should not try to overdo it, because once we overdo a physical exercise, it affects the adrenal gland, which is one of the main glands in the endocrine function. So in other words, you'll find that you cannot recover, you'll be more tired, so you're minimizing or actually compromising immune function, and in the long run, you're developing other diseases. So it boils down to what I've said, to every good thing there's a bad thing, but we must know in what range. So we call in here for at least people who understand how to help others be engaged in aspects of physical activity so that they could derive the benefits of that towards high health.
Now, you've talked about everyone can be physically active from a baby to an adult. Who can be considered as being physically inactive?
Physically inactive can be anybody who is physically inactive. I mean, here is like, okay, there are cases where we could say somebody is having a medical condition that cannot make the person active. But then there are still other physical activities you can do. Take, for example, you can do the yoga exercise, you can do meditation. These are exercises which are physical. So you find that you can manage emotions, you can manage all other conditions, you can settle the enzyme function, the body aspects. And best still, what is so interesting about physical exercise, science is trying to tell us that it wakes up the genes which are dormant sleeping, which are necessary for health, and it silences genes which are misbehaving. So you can see the most benefit that can be derived from a simple exercise or engagement you're taking in school.
Now, moving on to our next topic, can you describe what a stroke is and how does it occur?
Stroke, as I've mentioned earlier, is a disease of the cardiovascular function which tends to occupy or hit the brain function. The brain, as compared to the body and the heart, they are linked to an extent where blood nutrients are got to go through the blood vessels. But the same problem which can happen on the heart muscles and within the vessels, within the organs, in the peripheral system can affect the brain. So assuming that by any chance or by any mistake, blood starts clotting due to the fact that it enters into the brain, it will get stuck and then it will deprive the brain from a number of vital functions and vital nutrients like oxygen. So in that particular case, you can find that the brain starts suffering. So you can lose coordination. There's misfiring of stimulus and impulses. So in that particular case, the brain can experience what we call stroke because it's not having insufficient oxygen, it's not having the nutrients. Then the muscles as well holding up the brain starts suffering. Then there are cases where the fact that the passage of the blood vessels in the brain is narrowed, blood can go in through pressure, so it will burst. So the brain can be overflowed with blood. That's another type of stroke. So it's mainly a disease which is located with the brain function. It's a consequence of cardiovascular incapacity to manage the function itself.
Now, what is peripheral arterial or vascular disease?
All these are terms which are more used to talk about the same thing in different ways. When you speak about vascular disease, vascular disease refers to a disease of the vessels. So if you look at it, I would practically say we have already covered that. But when you speak about peripheral, it means that, you know, we have got the central and then the peripheral system, meaning the lower limbs. Take, for example, we have talked about thrombosis. Yeah. Thrombosis can be a very typical example of a peripheral disease in the sense that we could have the blood vessel being blocked with the fact of the clot in the lower limbs. So this is what is experienced and called deep vein thrombosis, which could be due to the fact that within the limb vessels there are always the sticking of the particles of blood which is clotting. That's one, which can be due to a number of reasons. This could be a sign, or it can sometimes be stuck in the pulmonary vein in the lungs, so that one can make breathing becomes very difficult. Or it could be something like collection of water in the lungs, which can lead to something of that nature. Different types of reasons. So these are all technical terms used to describe the same thing in different ways for different parts of the body.
So thank you very much for your time.
You're welcome.
I hope this information has been helpful to everyone and everyone takes it in and has a clearer understanding about these different types of diseases and how it is common in everyone's day-to-day lives. Thank you very much for watching our show. You can join us next week for the French version with Clementine, or you can watch us again the following week for the English version. If you have any comments, anything you would like to contribute towards the show, please feel free to email us at loveyourhealth@outlook.com, or please, you can go onto our website and have a look on www.healthnutritionfitness.co.uk. Thank you.
Love your health, aime ta santé, linga santé na yo.
Oyo Health Nutrition and Fitness CIC ememeli biso na kati ya communauté africaine. Kombo nanga ezali mama Anne-Marie Bendo pe basusu bayebinga na kombo ya mama Anne. Health Nutrition and Fitness esalemi po esunga communauté africaine en général. Pona to découvrir que biloko mingi oyo tozali kolia ezali na mafuta to ba graisse ebele. Ba graisse misusu ematisaka to ya cholestérol na makila. Pe cholestérol ezali facteur moko monene oyo ezali komema bokono ya motema, AVC, to stroke pe hypertension. yango wana na kati ya talk show tosali rubrique moko ya 15 minutes oyo tobengi yango Healthy Cooking with Auntie Annie. Tokobanda kolakisa bino ba recette oyo ekosunga biso poto réduire mafuta pe ba graisse na biloko na biso ya kolia. Toko se base mingi na ba ingrédients oyo tokoki ko trouver yango awa sur place na Europe pour mutu nyonso tout azala na possibilité ya kozwa yango. Yango pe de temps en temps tokobanda pe kolakisa bino ndenge nini tokoki kolamba biloko oyo tomesana kolia na Afrique, surtout selon ba normes diététiques. Na émission oyo na kolakisa bino quantité ya biloko ndenge nini tokoki kolia, na ko parler mingi sur 5 groupes ya biloko pe na kolakisa bino tina ya cholestérol ezali nini pe esalaka nini na nzoto selon explication oyo touti koyoka epai ya Dr John. Na chaque émission na kobanda ko présenter bino recette moko ya petit déjeuner, recette mosusu ya dîner pe ya souper. Lelo na ko parler mingi sur the Eat Well Plate oyo gouvernement ya Grande-Bretagne eza ko recommander na biso surtout tokoka kolanda po tozala na bonne santé. Eat Well Plate ezali nini? Eat Well Plate ezali groupe ya biloko mitano oyo mutu akoki kolia na mokolo to pendant 2 jours pona esunga ye santé ezala malamu. Groupe ya liboso ezali groupe oyo ya ba légumes to ba fruits. Groupe ya mibale ezali groupe oyo babengaka na anglais starch food ou bien ezali groupe ba féculents en français. Na groupe ba féculents ezali biloko lokola ba mboma, lokola makemba, lokola fufu, semoule, lokola kwanga, yango ezali na groupe ya mibale. Groupe oyo ya misato ezali groupe ya oyo babengi misuni oyo tomesana kolia, mbisi, maki to biloko oyo surtout oyo ezalaka na mer, yango ezali groupe ya misato. Groupe ya mine ezali groupe oyo babengi produits laitiers, ezali groupe ya ba miliki, ba yaourt, fromage to ba yoplait. 5e groupe ezali groupe ya ba boisson to masanga oyo ezali na sukali ebele pe biloko oyo ezali na ba graisse ebele lokola ba gâteau, yango ezali na 5e groupe. Sikoyo na the Eat Well Plate, gouvernement ya Grande-Bretagne recommandé mutu na mokolo okoki ko répartir biloko wana pendant toute la journée. The Eat Well Plate na français babengi yango l'assiette équilibrée. Ezali sani oyo esengeli mutu akoka kokokisa biloko nyonso tu wana po ko kosunga ye po na santé na ye. Na kati ya Eat Well Plate tozali na 5 groupes ya biloko. Groupe ya liboso oyo nalobaki ezali ba fruits na ba légumes, esengeli mutu alia 1/3 na yango. Groupe ya mibale oyo ezali ba starch food oyo babengi na français ba féculents, esengeli mutu alia 1/3 na yango. Lokola makemba, mboma, kwanga, mais on repartir encore pendant toute la journée, ezali te olia onka na mbala moko.
Il faut kolia ba fruits na ba légumes ebele. Ezali recommandé ya kolia 5 sortes na yango par jour. Yango babengi yango principe ya 5 a day. Il faut kolia pe ba féculents ebele na mokolo, lokola mapa, loso, mbala, ba pâte, kwanga, mboma pe makemba. 3 groupes oyo etikali, gouvernement asengi to repartir yango boye. Ba miliki to ba produits laitiers lokola yaourt to fromage esengeli to consommer 15% na yango na mokolo. Ba misuni, bambisi, maki, ba madesu pe biloko misusu oyo ezali na groupe ya ba miliki te kasi ezali na ba protéines lokola soya tokoki ko consommer 12% na yango. Babiloko to masanga oyo ezali na mafuta ebele to sukali ebele lokola ba jus concentré to ba gâteau esengeli to consommer kaka 8% na yango na mokolo.
On a lelo na ko expliquer bino ce qui cholestérol ezali nini po yango nde ezali problème nene o ezali koboma biso baafricain. Place toutaka na Afrique tozalaki na biloko ebele ya kolia. Babiloko na biso mingi ezali bio o babengi na anglais organique. Mais problème ezali nde quantité ya kolia biloko wana nde toyebaka te et puis ndenge nini na kolamba biloko wana. Na coutume na biso baafricain tolingi kolamba biloko na mafuta ebele. Bon, na Afrique ezalaki mwa malamu po mo ezali muto za kotoka et puis twandoza na mouvement mingi. Tandis que na mboka oyo tokomi ya poto climat ezali ndenge mosusu neti siko tokomi na temps malili bato mingi bazalaka enfermé na ndaku et puis biloko soki toza ko continuer kolia kaka ndenge toliaka na Afrique yango eza kosala que ba graisse eza kovanda na nzoto eza kobota cholestérol ya mabe na makila. Yango ndenge docteur John autaki ko expliquer biso soki cholestérol ezali nini na komeka susu kolimbola ngo mo muke na lingala po muto nyonso tu akoka ko comprendre yango po ezali facteur munene oyo eza komema babokono ebele. Cholestérol ndenge docteur John auti ko expliquer cholestérol ya nzoto esalamaka à partir ya foie pe mosala na yango ezali po ekabola acide gras oyo ba organe ebele ya nzoto ezali na besoin na yango na nzela ya makila. Nzoto esalaka cholestérol oyo ezali na besoin na yango. Soki eleki ebele na makila ekokende kovanda na paroi artérielle. Kuna ekokangaka nzela na makila pe oxygène po ekoma na motema. Yango to ya cholestérol na makila ezali moko ya ba facteur oyo ememaka bokono ya motema. Na kosenga na communauté africaine en général que beaucoup kaka kolandaka biso chaque semaine pour émission oyo eye awa pona kosunga biso. Soki moto nyonso tu na communauté oyo azali na likanisi ya malamu oyo amoni que akoki ko soutenir émission oyo na selon na ndenge ba conseil ou bien azali na recette moko oyo akoki kosunga communauté pona améliorer habitude na bango ya kolia akoki ko contacter biso to ko étudier recette na ye soki tomoni yango ezali bien pour la santé soki tokoki kolamba yango selon ba norme nutritionnelle tomoni pe que ezali bien pour la santé donc inviter ye aya na émission pour aya ko présenter recette na ye moto nyonso tu oyo azali na suggestion ko sala to azali na remarque to azali na conseil moko ko pesa biso a hésiter te a contacter biso na email adresse na biso oyo ezali loveyourhealth@outlook.com. Soki pe olingi koyeba mingi na oyo etali émission na biso okoki pe ko visiter site na biso internet ezali www.healthnutritionandfitness.co.uk. Kuna oboyeba eloko nini Health Nutrition Fitness esali po ete ekoka kosunga communauté likanisi oyo utaki wapi ndenge ni tokomiti na niveau oyo. Nasuki lelo awa pona mokolo ya lelo na tombeli bino poko welamu tokutala mbala sima na ko parler sur premier groupe ya biloko oyo ezali ba fruits na ba légumes et puis na ko parler sur principe ya 5 a day na ko lakisa bino pe ndenge nini ya kolamba pondu oyo tomesana kolia na Afrique mais cette fois-ci na ndenge oyo ko kozala malamu pona santé tokomi mbala ya sima. Soki natali awa tozali na 5 sortes ya bandunda awa oyo miso kotaka na kati ya pondo na 5 a day baza kosenga biso to consommer au moins 5 sortes ya bandunda na ya bambuma. Déjà natango olambi biloko tie déjà 5 sortes ya biloko oyo ozomona te que o respecter principe ya 5 a day mais eloko za kozanga yo kaka ezali bambuma. Bambuma okoki kozwa ndenge nini nde nalobaki liboso na petit déjeuner na yo na ba céréales na yo okoki ko utiliser na kati ya céréales na yo okoki ko tia ba raisin to ba abricot oyo kokauka okoki pe komela verre ya jus oyo ezali pur na dessert na yo pe okoki kolia pe bambuma to na ntango oyo babengaka goûter okoki mpe kolia ata mbuma moko ozomona soki déjà olie pondu na mokolo wana et puis olie bambuma nyonso tu nauti koloba wana okokisi
pondu bato baza na neti na Afrique kuna elambeli eza ndenge ebele bamisusu bazwaka na pondu ndenge yaki na Afrique okosukola pondu no bien po pondu eutaka tout d'abord na mabele bazobuka ngo na bilanga eza na mwa basalite ebele banyamba banini il faut kozwa temps na yo osukola pondu très bien soko sukoli pondu très bien ozwi otuti mosusu bazwaka batima ya moto to kamolia mpona kolongola nani basalite na bamicrobe mosusu ta mosusu ya bazamba ya babiloko soki batuti pondu ekomi bien otia yango na moto oti pondu na moto bamisusu basalaka bati pondu atokisi yango nanu pondu mpenza échanger couleur ekomi lokola mwa elongo mpenza vert oyo ya makasi ekomi na vert moko fo monaka pondu ebeli okamati mbisi oti bamisusu batiaka pichard bamisusu batiaka mbisi ya okauka ça dépend ya mutu na mutu ndenge alingaka eloko nini ayaki otia na kati okati otuti matungulu otuti ndembi oti aubergine oti bon ça dépend pe ya ba moyen ba msusu bazwaka matungulu akati ati mbisi ne mbala moko ati biloko nyonso ati mwa mu oti